Well, thank you for joining us, everyone. Women in Science is honored and thrilled to have Dr. Joan Reede with us. Dr. Reede has a very distinguished medical career, as well as the first Dean for Diversity and Community Partnership at Harvard Medical School, which has been designed to provide leadership and support to promote increased recruitment, retention, and advancement for historically underrepresented faculty, trainees, and students. And we're going to hear from her today about her current work, some of her history. And so she's going to offer us a presentation for about 20 minutes or so. And we ask you to think about questions you might have, because we're going to leave about 30 minutes for questions at the end. Also, please, if you're interested in joining Women in Science, please join our team. Look us up on our website. And I'd just like to quickly thank and highlight the members of Women in Science who have joined together to create this wonderful event. And so now we will hear from Dr. Reede. Thank you all.
Thank you. I hope you can see my screen. Very good, thank you. So thank you for this invitation to speak with you today. And as Mary said, I'm going to present probably about 25 minutes and then really open it up for any kind of questions or conversation that you like. So be thinking about how you'd like to proceed, but want to give you some background around the work in DEI, diversity, equity, and inclusion here at Harvard Medical School, and my perspective on part of this work. And how it has created change over time. And let me see what is going to work on my computer for advancing slides. And right now, I'm going to have to do it this way. Okay, so I'm going to begin in a space around our mission and value statement for the medical school. So when I first came here, the mission of Harvard Medical School is not as it is today, where diversity and inclusion are embedded within the mission of the school. So very important. If you look at the Sullivan Commission recommendations, if you look at National Academy recommendations, this idea of embedding diversity and working towards diversity within the mission of the organization is important, because it moves this work from being an aside to something that's central and something that's thought of as foundational in terms of the work that we do. But it's also in our community value statement, where you see diversity and respect as one of the 5 categories, but gets very specific about a culture of inclusion, where we think about inclusive excellence, but also promoting equity and social justice. So these are part of the mission and values of our organization. And there's also a diversity policy and diversity statements for the school. Again, our unique perspectives, talents, experience, our contributions are what are drivers of our excellence. So it's not an aside, it's not just a nice thing to do, it gives us strength in terms of what we do. Right now, I am trying to advance this, and advancing my slides is not working. Okay, so why do I think diversity is important? I'm going to frame it in this way. And I want each of you to also think about why diversity, equity, and inclusion might be important to you. And I think of it as serving 3 purposes. One is around realizing our values in academic medicine, addressing complex issues, and ensuring our viability. And I think of it as, and our office's name is actually Office for Diversity, Inclusion, and Community Partnership. And how do we include this work around diversity in all of the fabric of what we do? So it's not owned by an office or a person, but it's a responsibility that we all share. And in realizing values, I'm speaking here really about social justice and equity. So if we think about the Charter of Medical Professionalism, where one of the principles is around social justice. So if we looked at, say, the Crossing the Quality Chasm report of the National, it was in Institute of Medicine, now National Academy of Medicine, within that, they talk about this issue of equity. So these are terms that we use within academic medicine. but it's also about how do we counter discrimination? How do we have and think about equitable representation and distributive justice? This right to equal access to resources and this right to have equal outcomes across different types of illnesses. It's realizing our values. And so what do I mean in this? And embedded in this is this idea that it's not just that picture of representation. It's not just about let someone in the room or have a seat at the table. It's to move beyond that. And so how do, as we create this change, ensure that different voices are heard? How do we make sure that those voices start to lead at the table? How do we make sure that those voices start to invite others in? So it is actually a change in how we operate, how we do business, how we create policy and practice. Within this is also this understanding that each of us represent multiple identities. So when I walk in the room and have a seat, I'm not just there as a African-American or Black. I'm not just there as a woman. I'm African-American. I'm a woman. I'm a doctor. I'm a mother. I'm so many different kinds of identities, and I'm bringing all of that. And part of this is about how do I bring all that I have to the table such that I'm able to help the institution achieve its mission and live up to its values. And it's all of these things in terms of my culture, my background, my family that are also coming to the table. So it's not just where I trained or how I trained. It's all of these things that come together. So multiple identities that intersect. In complex issues, part of this is saying that for us to really address the issues that so desperately impact our patients, our communities, extremely complex issues. We talk about the social determinants of health, but we cannot tackle them by looking at one discipline or targeting one area. And I think COVID was this wonderful example for us where we were brilliant in our science and came up with this vaccine very quickly, built on work that had been done for several years before. But it wasn't just, can we come up with a vaccine? Could we get to the vaccine to the people who needed it? We had to start to think about how we communicate. We had to think about population health. We had to think about public health. We had to think about all sorts of other things. So it wasn't just, can the scientists create a vaccine that would work? It was how all of these come together and who has different kinds of access and the ways in which our system is so very imbalanced, complex issues that requires us to work together in very different ways, use different kind of knowledge. Viability is really about how our country's changing. Our world around us is changing. It's part of what we are hearing and people responding to when we see what is going on in the news, et cetera. Some people are very fearful of the change. And when I first started this work over 30 years ago, people would say, Joan, why do you talk about this? And why do you talk about demographic shifts? Oh, that's a century away. It's here. It's now. The country has changed now. And if we think about the children of today, those under 18, who are going to be our college graduates, our future doctors and clinicians and nurses and technicians and all of those different areas, increasingly diverse. And we need to be able to identify them, nurture them, bring them into our professions and retain them in our professions. And that's something we need to be thinking about now, not into the future. So how do we work with community? Another part of this is, for me, oftentimes people will talk about the pipeline and how do we address the pipeline. And I actually don't like the term pipeline. I haven't used it for about 10 years. I say it because that's what people think of, but I immediately moved to pathways. And my rationale is they talk about a leaky pipeline as though, you park your car, you look under it, there's a puddle or something and you drive off and it's left behind. And for me, that is not people. That is not people. And I think about multiple opportunities for entry, exit, and re-entry into the system. I think about multiple paths and directions for wherever someone's going to take their career. And with that in mind, have designed programs that cover multiple levels across this continuum from early K-12, remember that this viability and people coming in, all the way up through faculty level programming. So this need for diversity is not just at those entry levels or what people call about pipeline or pathways. It's all the way through. So if we start to look at leadership, if we start to look at who are our professors, who are our chiefs, who are our department chairs, who are our presidents of our institutions, who are our deans of our colleges and universities, a need for diversity across those areas. So I'm going to give you some examples of some of the programming we have, not trying to cover everything, but for examples. And for part of it is around K-12, it's curriculum development, teacher professional development, programs in and out of the academic year, programs for K-12, for college students, for medical students, at postdoctoral fellowships and faculty programs. And so at the K-12, the pipeline or pathway program, we do programs, say, with AP biology, where what we found there was this unequal distribution in terms of access, resources, and preparation for students across schools in terms of were they prepared to even take the AP exam? Were they offered the same materials? And so for a number of years, we have been partnering with Boston Public Schools and teachers where they do part of the AP labs at Harvard Medical School, where they get tutoring and help in taking the exams. And so there were schools in Boston where, say there were 12 or 14, whatever number of AP labs and things you worked on across the year, where students did a half of them or 3/4 of them, and then were supposed to take an exam that they would never pass because they had never had all the materials. So how do we help give the materials? How do we support the teachers? How do we help prepare students to take a test where other students are taking all of these other support kinds of tests and books and preparation, and then you have other students who are getting no preparation at all. So how do we level the playing field? We've had for a number of years a high school summer research program and also programs that we've done for middle school students. All of this has been shifted somewhat as we've had the pandemic, but we still have been running virtually our project success and our research programs and our AP biology programs. Just because there's a pandemic does not mean that these students still don't need to be supported. And so how do we support them so that they are not lost? And that they understand that they're still valued and that we still need them in our profession. Visiting clerkship program is for medical students. It's been around for 30 years. And it takes advantage of the exchange clerkship programs across medical schools. And it's an opportunity for students to do 1-month rotations in our hospitals and in our departments. And you can see here over time, over 1,500 students have participated. Many have returned to Harvard Medical School for residency and for fellowship. Many are now on faculty within our institutions, but it's been a way to understand that for Harvard Medical School, as with many medical schools, the way our entry into our junior faculty and to affect those numbers is through our trainees. That many of our instructors come from our fellows, and our fellows are coming from our residents. So unless we impact at that level, it is virtually impossible to get a significant change or increase in our diverse faculty. And here I'm talking about underrepresented medicine, Black, Hispanic, Native American. So if I go over this 30-year period, when I started at Harvard Medical School, there were roughly 185 UIM faculty. Now there's over 700. So this is being very deliberate over time in this space. And here you see the residency showcase where students are coming in from across the country to actually meet residents and training directors and to understand more about our programs. It moved virtually over the past 2 years. It's coming back in person. Hopefully some of you will get involved in some of these programs. Some of you actually may have come through the programs. There's also the visiting clerkship program is for mostly third, fourth year students. The visiting research internship program is for first year students, first and second year in between, and saying here's another opportunity to do research at Harvard. And here are some outcome. And I think it's important as we do diversity programs to make sure that they are data informed, that they are evidence-based, and that we are looking at outcomes. And this sort of CQI lens of how do we continuously improve our programs. And so here you see from 2009 to 2020, some first results from this. Of the students who are in, 57 of 71 were underrepresented in medicine, that roughly a third attended historically Black colleges and universities or Hispanic serving institutions. Many went on to participate in the visiting clerkship program that I mentioned. We also have a research program I'll tell you about, New England Science Symposium. But importantly, of these students, these 71 students as of 2020 had co-authored 188 peer-reviewed publications, highly productive. Okay, but then you can sort of say, all right, that's good, but what happened? So as of that 2020, 50 had completed their MD and 46 were currently in residency or had completed residency. Some had come to our hospitals. Some were in our institutions or in fellowship programs, but 3 were already faculty members in institutions. So this idea of multiple points for entry, exit, and re-entry, not a leaky pipeline where people are lost and gone, but how do we think about retaining and supporting individuals over time? Multiple fellowship programs, our faculty fellowship programs, Commonwealth Fund Fellowship, and Joe Henry, I'm going to talk about the first 2. Our faculty fellowship programs, a program that actually supports individuals at the instructor, assistant professor levels, 2 years of funding, $50,000 a year, to really help buy out individuals' time, to release that time for them to pursue their own research or their work. And if we look across this, again, some of the outcome of the first faculty fellows or the fellows from these cohorts, there's some other additional faculty fellows we had. High retention of the 49, 14 had left Harvard, but most have stayed. And then of those who left, they remained in the academy and were promoted and moved forward. Of those who stayed at Harvard, 71%, 80% had been promoted. And now we have an additional one that's beyond this. It's a full professor, but we have chairs and chiefs out of it. Again, this tracking over time and multiple points of entry, multiple points of intervention. Commonwealth Fund Fellowship Program is a 1-year fellowship program for individuals who are particularly interested in minority health, interested in creating change that impacts vulnerable populations, where we fund an MPH or an MPA, and it's that there's a stipend that goes along with it, but also really leadership training. And many of these individuals are in our institutions and around, but you can see here individuals such as Joe Betancourt, who's at MGH, but Nawal, who's chair of OBGYN at Brigham and Women's, the head of OMH, the Office of Minority Health for DHHS, the head of PCORI, individuals who are in multiple positions across the country. Octavio Martinez, who heads the Hogg Foundation, but is also on the COVID task force, individuals who are now on the AAPI task force and committee that's coming out of the feds, et cetera. So individuals moving into leadership positions. The Biomedical Science Careers Program is started out of our office. Spun off as a separate 501c3, but still exists and resides within our Harvard community in our office. And this is one where we actually partner with multiple organizations across sectors, from academic institutions, hospitals, industry, professional associations, in identifying individuals from high school through postdoctoral level from across the country who are interested in the biomedical sciences, and offer programming for them that is free. And so you see here over 15,000 students involved, over 1,500 actually volunteers, multiple states, multiple academic institutions, and ongoing programming. It's been around for more than 30 years. And I mentioned earlier a research symposium. So a New England Science Symposium where students actually come here and present their research. And I think we're at about 9,000 or 10,000 students who've participated in this program. We've just had some programming here. And it's an opportunity to see really impressive research that's being done by diverse individuals from across the country at multiple levels. There is an equity and social justice program that we have headed by Alden Landry, who actually came through Harvard Medical School as a visiting clerkship program student, then participated in the Commonwealth Fund Fellowship, who is now an assistant dean here and heads this initiative, and ways to get involved with that. And multiple ways in which There are offerings that are open to the whole community. The annual Leadership and Faculty Development Conference, we just had that. Is an annual meeting around minority health policy. There's other dialogues and leadership programs and forums, and we'll tell you a little bit more about them, but multiple ways to get involved in those kinds of things. And awards from our Community Service Awards, Diversity Awards, Community Service Awards and Diversity Awards, Equity and Social Justice, the newest award that we've added in the past year, are open for faculty and trainees and students. Mentoring awards for faculty at multiple levels, Exceptional Service Award for faculty and for staff. If you think about all the committees and all the work that individuals do in advancing diversity, equity, inclusion, and other kinds of ways that actually hold up our institution and enable us to achieve our mission, getting recognized for this work, but also this work counting towards promotion. So Better Together, when George Daly, our dean, came on board, put together a committee, a task force of diversity and inclusion that met for about 2 years and came up with a long-term plan for how we could move forward in terms of our DEI efforts, and came up with this Better Together. It's built on this concept of inclusive excellence, that you can't have excellence without inclusion. They come together. And this is also part of what the university's plan is also built on. And it has 4 buckets addressing culture and communication, developing people and infrastructure, holding ourselves accountable, and building community. And I'm going to give you some quick examples of some of what's been done in this space. If you think about some of this work, however, what do you get out of it? And why should we care about it? I think improve recruitment, retention, productivity across all sorts of levels. How do we become more responsive to our patients and families? How do we become more responsive to our community and the communities around us? And what does this allow us to do? I've talked about some of these things in terms of our values, in terms of creativity, in terms of viability, things that we profess to do. And so what does it mean for each of us as we think about this? In our work, we are going to have to work with a more diverse workforce, that our units are going to have to recruit and nurture and retain diverse individuals, and thinking broadly about what that diversity means. And it's not just how do we bring people in, but how do we address our culture and culture change so it's such that people can thrive and fully feel that they are valued and contribute. And then what's the work for each of us in terms of our own toolbox and our own ism and our own personal journeys in this space. So for our organizations, it's starting to think about to be working around these issues of DEI and inclusive excellence. And where does it fit in? I say it fits in everywhere. Higher performance, advancement, retention, grievous. What are the things that we're doing in terms of mentoring and sponsorship? How are we engaging with community? How do we conduct our business? Who is and is not at the table? Whose voices are and are not heard? Who feels like they belong in the institution? But each of us has a role in this also. So it's not just the organization. What is our role? And for us to start to think about, how do we engage? How do we advocate? How can we be allies? Who is in our personal networks? How do we lead as we move forward? And how do we think about who comes behind us and who is replacing us, and making sure that there's diversity in that space? So for me, it's about how do we become more knowledgeable about some of these DEI efforts, and think of this work around anti-racism, and our need to own the responsibility for that, our own personal responsibility for that, and self-reflection. So it's not just what I read or what I hear, but then how do I reflect? It's this understanding that this is not a one and done, this quality improvement, and how do I keep coming back to this work and making sure that my work is evidence-based and data informed. Understand that a lot of what we're talking about here is power and power imbalance, and how do we acknowledge it, and what do we do about that? What do we think we know and not know? And I think that the recent Slavery and Legacy of Slavery report that was just released by the university is a wonderful example where so many were surprised that there is a legacy of slavery within Harvard. And you want to say, but Harvard has existed for centuries, and centuries where slavery was legal. Okay. And so there's a part of me that says, why are we surprised that it had a role here? Why are we surprised that racism had its impact here, and that part of our faculty were involved? If you think about eugenics and all these other things, Harvard was not immune to that. So how do we acknowledge it, understand it, and understand the impact of it today, not just in the past? How do we demonstrate real support, not just words, but in actions? And how do we build diverse and inclusive networks? So, and examples for my own space, DICP, you could apply for fellowships. You could serve on committees. There's lots of committees that we have from our Better Together committees in terms of how do we move this DEI agenda forward. There are several. LGBT Advisory Committee. I mentioned all these awards and selection committees, and nominate people for awards. How you could be a judge or an advisor across these programs. You could be a speaker across these programs. You actually end up being role models for many of the students and people who are coming along. How do you collaborate? We have a research and evaluation arm, and how can you collaborate in that space? So many resources. I'm going to stop sharing now. It gives you sort of a backdrop in understanding some of the work that we have and that we do, and really just leave it open to ask any questions or talk about anything that you'd like.
Thank you so much for that amazing talk. That was so informative and beautiful. Thank you so much, Dr. Reede. I think we as a panel had one question we wanted to ask, and then we do have a couple of questions in the Q&A that I'll get to. And then if people would just put any questions in the chat, that would be wonderful. You have an incredibly distinguished career and have yourself created pathways for students and trainees to be included and to succeed. And as you shared with us, amidst strongholds of systemic structural racism and a lack of inclusion, and there are many barriers women or, and folks from underrepresented groups can face.
So Mary, I think your screen froze.
Oh yeah, I think she, okay, maybe we can wait till she comes back and I can just read out the questions that are already posted here, right? Okay. So one of the first questions was that you mentioned evidence-based measures. Could you share what measures you feel have good traction for DEI and just medical education?
Right. I give you some things that we always do. We count numbers, and I talked about a number change from 185 to over 700. That's a big number change. It's a significant, and there are actually more underrepresented medicine faculty at Harvard Medical School than at any other medical school in the country. But part of that's because our faculty is so large. But it's not just that. It's are these individuals being retained? In other words, so sometimes people will celebrate, they'll say, oh, look, we had a banner year for diversity. We've increased by 100%, right? We've gone from 2 to 4. Do you step back and say, are those 4 new people because you lost the other 2? Okay. Are we retaining individuals? Are people cycling through our system? So how do you start to look inside to understand what's going on? For me, it's a matter of, for our programs, are they retained? Are they promoted and advanced? Are they getting grants? Are they getting awards and nominations? All of those things we track over time. But in addition, we've also built the capacity to start to understand within the institution, what do their networks look like? And how does that impact their productivity? And so several years ago, as an example, NIH had from the director, gave out national awards for how to think about DEI in a different way. and to move things forward. And we received one of those 6 awards. And what we built out was, again, this capacity to ask different kinds of questions, to understand what is the experience of individuals within an institution, so that we could begin to know where to target our programming and target our efforts over time. And so for us, it's creating new ways of thinking and looking at data, new resources for data, largely because the technology has changed so that we can do some of that. The other things that we're doing now, there's also work that's being done on a national level that's starting to look at what are the barriers more specifically, and ways to impact. So you might want to look at some of the National Academy reports that have come out recently about some of these issues. But there is a roundtable on Black men and women in STEM that that I'm a part of, but George Daly, our dean, is also a part of, that has been meeting and has several reports that have come out that contain the kinds of data that we're tracking and looking at over time. And it's very specific to the program. So an example would be someone who comes and says, Joan, you have these high school programs. How many of your high school students went to medical school? Okay, funder. And I'm saying, how many of my high school students had an opportunity to take an AP class? How many of my high school students went to college? How many they matriculated? How many of my high school students graduated from college? I mean, it's sometimes the data that we're tracking are not relevant to what's going on right here and right now. And so for me, it's what is the issue we are trying to target, and how will we know if we've addressed that issue? So I talked about AP biology. Some of our concern was students don't even have the materials to be able to pass the course if they did it. Are they getting the materials? Are they able to take the test? Are we helping to prepare them for the test in the way other students are prepared for the test? Then do they take the test? Yes. Are they passing the test in these places that they didn't pass before? And is it making a difference? So we're tracking all of those things for all of our programs. And we're building the metrics and what we want to track for us personally, but also working with the teachers. What do the teachers think is important in this process? What do the students think is important to track in the process? The other part that's interesting, we'll see what will come out of it. There is also a National Academy Committee right now that's been convened to look at anti-racism and DEI in STEM. And a report will probably be coming out this fall that will also contain recommendations around what should be tracked over time.
So, Mary, do you want to ask your question maybe? And then I just started reading since you dropped off. Yeah.
Oh, no, thank you. I appreciate it. I don't know what you heard, but where I got cut off, but I'll just quickly, with your incredibly distinguished career and you creating pathways for students and trainees to succeed against strongholds of systemic racism, as well as genderism, sexism, these are things that can range from experiences that are structural barriers, as well as like interpersonal barriers, microaggressions. There's many ways that exclusion happens, right? Or a sense of exclusion. So we wanted to ask, what are key roles that PIs and senior leaders can play in our institution or in our labs, along with people being allies to play in creating DEI related understanding, policy, like comfort talking about, and to be inclusive and ask people from these groups, for their input, not.
Right. So this is going to sound probably a little disjointed and all over, but you just asked about 20 questions in one question. So you're going to get a 20 question kind of answer. So, and you asked from a leadership perspective about what they could do or what leaders could do in this space. And I'm going to go back to part of what the head in the slide, become informed, and own responsibility for being informed. And with it, and so that's reading. It's saying, maybe I should attend that seminar. It's the same way you got informed, excuse me, about everything else we do in medicine. You read, you went to seminars, you taught, I mean, all of that comes into play. Excuse me, and then reflect on what it means for you. And understand it's not a mea culpa, oh bad. It's all of us false way to the isms that exist in our society. And those isms that exist in our society are not just outside our walls, they're inside our walls too. And so some of it's are opening our eyes to the fact that they exist. And as you begin to understand that, to also begin to accept that many of your faculty and trainees have a different lived experience. And one of the things that can be so frustrating is when you say such and such happened and somebody says, oh, I can't believe that. Or that must be happening over there and it can't be happening here. No, it's happening here. And it's our lived experience. So accept it. Accept it. Not as this is not a critique. It just happened. Okay.
Mhm. Yeah.
But the onus is also on you to both listen, to trust, to try to understand, to ask questions, but don't put the onus on the person, that marginalized person, to be your personal educator,
Yep.
to solve your issues and problems. One of the things that can often happens is this, and it's for multiple reasons. As our institutions and our leaders want to address, and I think they truly, genuinely want to address these issues, you're turning to the people who have been marginalized to say, excuse me, what should we do or how should we do it? But you're also putting a burden on them to educate you and correct the system. You're putting a burden on them to educate you, correct the system, to not be compensated for it, to not get credit for it when it's time for promotion and advancement and recognition. So you're saying, can you help us to do better and be better in achieving our mission? But I'm not going to count your work towards us achieving our mission. And so for me, the school, even saying that this advocacy work and DEI work can count towards promotion and advancement, the school recognizing the importance of mentoring and community work is critical. But our departments also need to understand it. This work makes our departments and our research and our clinical service and our education better. It makes us better able to meet the needs of our patients. And so for me, it's part of that's taking that in. It's saying, now that I am more knowledgeable and I can say the right things, I'm going to say, don't say it in Black History Month or AAPI month alone. This is 24/7, 365 days of the year that these issues exist. And thinking about this and seeing how equity has a role in our decisions across the board is something that should become an expectation. How would this policy change differentially impact certain populations, okay, or different kinds of individuals? How do I get that way in and that perspective and that understanding and make sure I have that? So that it becomes part of our nature to think about it. How do I not put the burden on people of, and I'm going to say for people of color, to help or to have expectation that they will carry the burden of our mission. So we need to hire more diverse individuals to serve our diverse patient population. But you need to hire more individuals and have an expectation that all of your faculty or trainees are serving diverse populations. And when you're hiring diverse individuals, their role is not to just serve those diverse populations, it's to maybe help you figure out how you can help serve them better, or the institution can serve them, but that's not their sole role. They're there as scientists and researchers and educators and lots of other things. Their role is not just to help with recruitment, et cetera. So it's not just the words, it's educating yourself. It's not just the words you say, but what are the actions that are being taken? There has got to be action that goes along with this. And with that action, are there resources that go along with it? I've had different roles in this DEI nationally, and I've seen so many places where institutions or departments or other identify someone to lead or champion a DEI effort, but they don't have resources, staffing, funding, other kinds of things to be able to do the work. Again, you're putting the burden on someone else to correct something. And if it's genuine, you have to put the resources in to get this work done and to move it forward. And then to say, what is it you're targeting? I mean, think of everything else we do. What is wrong? What is it we're trying to improve? How are we going to try to improve it? How are we going to know if it's changed or improved? How are we going to hold ourselves accountable for that and measure it and reiterate an iterative process? DEI should be done in the same way. It's a long roundabout thing, but we have this expectation for evidence-based and doing all the things I'm talking about for all of the other things we do in academic medicine. Why would we not have the same expectations when we think about DEI? Why would it be different?
Yeah, this is such an important point because I feel at Women in Science, like in our group, I think we've discussed the concept of invisible labor so many times. It just keeps coming up. We go to DEI meetings, it's always the same people that we see doing the work. And many times it's, like what you said, it's the burden, like it's also people who feel marginalized or are underrepresented who are doing the work. And I'm so thankful for you to just hit that.
Some of it's coming from the institution, some of it's coming from us, because we know that there are people coming behind us, and we care passionately about this. And so we want to contribute and we want to make a difference, but our passion should not be used by the institution and to create a burden for us.
Thank you. Can I read the next question? So the next one is, what formal and informal structural changes and interventions would you recommend to increase retention of faculty members from historically marginalized communities?
So I think part of it, I've given some examples of some of the things we've done in terms of recognizing what are the challenges that individuals have and ensuring some of its concrete resources. Our faculty fellowships, we give resources. Our Commonwealth fellowships, we pay for degrees. We expand people's networks. We ensure that they get mentoring. We ensure that they get visibility. And doing those things, you saw some of the outcomes. They actually work. I think that we need to do more of building community across individuals, across parts of our communities. It's all too often, it can feel isolated. So even though there are more women faculty here than before, and there are more underrepresented medicine faculty, you can still feel very isolated in your department or your division. And so how do we create the spaces so that we can start to feel community and feel like there's supports and collaborators and others to come together? And as we do that, how do we also acknowledge the fact that many of us hold multiple identities? You know, that several years ago, I was speaking and sort of leading. There was an effort at NIH, NSF combined conference, 2-day conference about mentoring women in science. And I was leading, co-leading a part about women of color in science. And at the end of the first day, part of the planners came to me and said, Joan, this is just not working. This is not working. You know, you have all these people in their meeting, they're talking, and your sessions are supposed to be dealing with women of color, and they're talking about women's issues. And I said, could it be that women of color have women's issues? Perchance. Could that happen? Okay. And how do we deal with the women's issues? But then are there other additional issues being a person of color or a woman of color? Again, complexity, intersectionality, marginalized on multiple levels. And so how do we create a space to understand that and to bring people together in that way? So those are some of the things. I think concrete programming, what are the issues or problems? asking individuals what is it that they want or need, not assuming what they want or need. And then as you put things in place, is that need being addressed? And also understanding that over time, how you structure your programs may need to change because the world outside of us is changing. I want you to think about the past 6 years and the shifts in our country from politics to policy to economics to health. All of these things are going on, and people are trying to pursue their careers in this shifting environment. And so how are the needs of the individuals in our institutions changing as the environment around them changes?
Yeah, absolutely. Like, maybe the next question. This is from Nico Tamestani. Thanks for the wonderful talk. You commented on how a lot of these changes take time, but research fellows or postdocs are often short term. Do you have any specific advice on how postdocs can support or initiate sustainable DEI initiatives during their potentially short time in the institution?
Right. This is going to sound sort of general, but it's my approach to a lot of EDI or DEI or however our idea, because anti-racism is in there now too. I'm a believer, and I started over 20 programs in my sort of career doing this work, that I do nothing alone. So if you look at all of the programs that I've established, they are all in collaboration with other individuals, with other units, shared thinking, complex issues about what's needed, where are the resources, how do we bring them together, what is it that we feel that we want to accomplish, how do we own the process and the product of it, how do we think about how we pass it along to others. And so I think sometimes we feel such an urge to create something that we're not thinking about who's going to do this work after I go. Okay. So for me, by creating it with others, you're almost insured with part of it about how it keeps moving forward. Okay. And understanding that when you do that, what you do, it may not look like what you started with. Remember I said the society's changing, the issues are changing, people are coming in, they have different views, but it's more likely to be sustained if you do the work with others. So for me, part of what I would say to postdocs is if you've got creative ideas, talk to people who are in these roles, who might be able to guide you to some people who are thinking about this, where you might be able to plug some of your ideas in, or who might be able to say, oh, here's a way that you might be able to build that or create that. But whenever I do that, I also say, is what you're creating short-term? Or if it's longer term, who are you creating it with? Is it something that you're creating within your department, within your institution? Is it something that you're creating with your professional association? Because there's things I do with my professional association that live longer. So even after you finish your fellowship or your postdoc, you're still with the association and you can still move it forward. So I think more in terms of long-term and sustainability in that way. And it helps with burnout. I mean, don't some of you get tired when you're doing everything by yourself, as opposed to these sort of supports and people around you?
Yeah, for sure. I think larger our community, the more we can get done as well, right? The next question, how can we more substantially support those who experienced racialized and intersectional loneliness, isolation, and powerlessness within the institutions?
Mm-hmm. So I said part of this before. One, recognize that it exists. Recognize that it exists. And that just because you've invited somebody into the door doesn't mean that they feel welcomed or that they belong. It does not mean that the ism that they experience outside is not going on around them in an everyday basis. And it doesn't just happen. It's not something that you experience just from patients or from families or from non-colleagues. colleagues have the capacity to hurt and to harm, not always intentional and sometimes intentional. So it's this unconscious bias, but there's also some conscious bias. It's not all unconscious. And so for me, it's acknowledging that and saying, where are the safe spaces to have connection, where people can feel safe, to have a safe conversation, where they can feel that they don't have to explain everything. And I'll give you the kind of example, it goes back a little bit, but that's my fellows, and I'll give you two examples. One, when Trayvon Martin was killed, and was meeting with my fellows, and we sat down and we cried together. Okay. And we cried together, and people were crying because of Trayvon, but they were thinking about their brothers and their fathers and other family members. They had this shared space where they didn't have to explain to someone why this hurt or how I felt. There was this safe space to be authentic and not have to explain, not help somebody else to feel okay about it. I also think about after 9/11 and some of the anti-immigrant and other things that went on then and have continued in our country. And another meeting with fellows, and one of our fellows, who Asian American, was flying back from a meeting, and she's third generation Chinese American. And as she's coming to the airport, someone says to her, "Why don't you go back to your home country?" And so she's telling, here's a safe space where you can have this conversation. And one of our fellows looked at her and then looked at the rest of the fellows and said, "Why don't you all go back to your home country?" He was Lakota Sioux and considered all of us as immigrants. Okay. Where is this space where you can say these kinds of things and not be worried about who am I offending, or that is it going to be a racist or non-racist statement? So I think our institutions can create those spaces. Sometimes it's affinity groups. Sometimes it's something as simple as our office offers a barbecue. It's in August of this year, and it's mostly for UIM new residents or some that are here. And some this year we're also inviting some new UIM instructors who particularly did not come through Harvard Medical School. And we do a barbecue in Lars Anderson. Okay. And it's a place for people to come together. That isolation I've just gotten here, oh gosh, I don't know anybody, I'm the only one. And so addressing isolation and seeing and meeting others. And they also bring partners, spouse, children. So it's like all of a sudden that this family piece. Now it's interesting because some of the feedback I got before was, if you're going to do a barbecue, then you should do it for all trainees. And I said, you mean like thousands of people barbecue? No. Okay. Again, it comes back to what is it you're trying to deal with? All right. There are individuals who are marginalized, racialized, isolated, the ones that you were just asking me about. Other people should not feel threatened because you've created a space for them to come together. It's not threatening anybody else. It's not a meeting to talk about anybody else. It's a meeting to say, I'm not alone. It's a gathering to decrease that sense of isolation. It's not a threat. It's not a threat.
Thanks, Dr. Reed. The next question is from Bin Deng. She says, thank you, Joan, for the wonderful talk. Are these institutional diversity facts and data open to all? Without this information, it's hard to understand how bad the issue is and where there has been an improvement already.
Right. So part of the data are available. And I would say for some of them, the data, and to be able to look over time, because I think you should also look at national data. And AAMC, it's very easy. You can go on their website and you can get data. And I think it's really important to look at those data. This is Women in Science. Please look at those data, because what you'll see as I'm talking about these issues of lack of representation in leadership is so very apparent there when you start to look at women chairs and look in clinical and basic sciences. Don't just look at clinical. And so look at the level of professor, and it's improved, but nowhere near where it should be. And at the level of department chair, decanal positions, and women who are deans within schools, look across the board. But also this disaggregation and this looking at multiple identities. So it's improved now. There's say about 180,000 faculty in schools across, medical schools across the United States. And there's just over 300 Black female full professors. Just over 300 out of 180,000. Okay. So when someone says this isn't an issue, that's when you step back and say, I beg your pardon. Help me understand why this is not an issue. A few years ago, I had a dinner, and at that dinner, I had 4 Black female professors. Do you recognize the percentage of Black female professors I had in the country at my dinner? All right, that makes no kind of sense. There is a dashboard we are creating for the medical school. So you can get some of these data on the website. Faculty Affairs has part of the data, and there's data that's put out every year for the school. And you can look there and see how these numbers have been shifting over time and trends. But we're also creating a dashboard, so you'll be able to get those. And that dashboard, an internal one, will be ready within the next couple of months, and then there'll be one that'll be more publicly available over time. But again, look at the data. I have found it has been invaluable in terms of developing programs. When someone says this really isn't an issue, and you say, really? Let's look at the numbers. Tell me why this is not an issue. Okay. And we ask for evidence in everything else we do. So it's online, it's available.
Well, thank you so much, Dr. Reede. This has been incredible. I'd like to thank you for joining us and for sharing your knowledge and your passion. And we hope to see you again at some Women in Science events. And please reach out to us as well. Maybe we can start to reach out and do what we can for your groups. And
no, and I thank you. And I shared with you some of the ways to get involved. There's all sorts of ways to get involved, and whatever's right for you, and to think about it. But there's multiple things, as I said, from speaking to being on committees to judging to nominate women for awards, nominate diverse women for awards within the medical school. But think about your professional associations, and think about all of the awards and recognitions, not just the awards for women or for people of color.
yes.
All categories of awards and recognition.
Yes.
Thank you for the invitation, and thank you for listening to me today.
Thank you.
Bye-bye.
Thank you, everyone.